Have you ever heard of migraines or maybe experienced them yourself? Just how debilitating can a migraine be? Today, let's find out. In 2008, pop icon Janet Jackson had to postpone her tour because of vestibular migraines. She really wanted to continue, she didn't want to let her fans down, but the severe headaches and dizziness forced her to stop. Actor and director Ben Affleck also suffered from migraines. While directing Gone Baby Gone, he had an attack so intense he was rushed to the hospital. So what exactly is this seemingly common headache? Today we're diving deep into the truth about migraines, how they've gone from being a medical mystery to something that quietly affects millions of people every day. What is a migraine? A migraine is a type of primary headache disorder. It usually feels like a throbbing, pulsating pain on one or both sides of the head, and often comes with nausea, sensitivity to light and sound, and other symptoms. Sound familiar? Maybe you've pulled an all-nighter for exams, and the next day you wake up with an intense headache that forces you to close the blinds, turn off the lights, and just lie in bed. Here's what makes migraines stand out. Throbbing pain, usually starting on one side and sometimes spreading, nausea and vomiting, sensitivity to light, sound, even smells. Some people experience visual auras before the headache, like flashing lights or blind spots. Cindy McCain once described migraines as, like someone hitting me in the forehead with an axe. For her, flashing cameras were unbearable. Wearing sunglasses was the only way to ease the pain. What triggers a migraine? There are many triggers, but genetics plays the biggest role. Other triggers include sleep disturbances, emotional stress, certain foods like chocolate, red wine, cheese. For women, hormonal changes during their menstrual cycle make them 3 times more likely to have migraines than men. Ever been jolted awake by a lightning bolt headache right before your period? That's menstrual migraine. So, what's happening inside the brain? Scientists have identified a few key players. 1. The trigeminal system. During a migraine, the trigeminal nerve, which carries sensation from the face and meninges, gets activated. It releases a molecule called CGRP, causing blood vessels around the brain to dilate and become inflamed. This neurogenic inflammation makes pain pathways hypersensitive, sending powerful pain signals to the brain. Some new migraine drugs work by blocking CGRP to stop this process. 2. Cortical spreading depression, CSD. This explains the visual aura. Before a migraine hits, an electrical storm spreads across the brain's cortex, first hyperactive neurons, then a wave of silence. This disrupts blood flow and can indirectly trigger the trigeminal nerve, leading to pain. That's why some people see flashing lights or shadows before the headache. 3. Serotonin, 5-HT imbalance. In migraines, serotonin levels in the brain fluctuate, spiking at first, then dropping. This affects blood vessels and nerve pathways and regulates CGRP release. Drugs like triptans work by stimulating serotonin receptors to prevent CGRP release and ease pain. How to treat a migraine. Acute treatment. If you're already having a migraine, the key is treat early, treat effectively. For mild to moderate pain, try NSAIDs like ibuprofen or diclofenac. For severe pain, or if regular painkillers don't work, use triptans like sumatriptan or zolmitriptan. These are migraine-specific drugs. Important: people with heart disease or stroke risk should avoid triptans or ergot drugs. If you're also feeling nauseous or vomiting, you can add anti-nausea meds like domperidone or metoclopramide. But be careful, overusing pain meds, more than 10 days a month, can lead to medication overuse headache. Preventive treatment. If you have more than 4 migraine days per month, or if each attack lasts over 12 hours, preventive treatment might be a good idea. Common options include beta blockers like propranolol, anti-epileptics like topiramate or valproate, low-dose antidepressants like amitriptyline, calcium channel blockers like flunarizine. Preventive meds usually need to be taken for at least 3 months and adjusted by your doctor. Lifestyle adjustments also matter. Keep a regular sleep schedule. Avoid staying up late. Avoid known triggers like red wine, chocolate, extreme fatigue. Try relaxation techniques, yoga. Some people benefit from acupuncture or neck massages. And if a migraine lasts over 72 hours, that's called status migrainosus, you'll need to see a doctor and might require IV steroids or pain relief. Migraines can be tough, but they're not unbeatable. By understanding the symptoms, managing triggers, and using the right treatments, you can take back control. Have you ever had a migraine? What helped you get through it? Share your tips in the comments, hit that like button, and subscribe for more science-backed health content. See you in the next video.